how does REBT actually work? So you've got a client in front of you. How do you work with a client using REBT?
Okay, well, first of all, we want to focus on what people are experiencing in terms of how they feel, their emotions, and what they're doing, and what seems to upset them, and why they're feeling the way they are. For example, if somebody's feeling profoundly sad or feeling depressed, we want to understand the nature of what they're feeling, how that's affecting them, and then we want to try to understand what's associated with the way they feel. And usually people will tell us about things that have happened to them, things they've experienced. Some of them are really horrible experiences that people have had. But when we get a bit of a better understanding of these things, we can then start to ask them questions in a particular way that helps them to share with us, share with me, the thoughts that they have and the ideas they have and what things mean to them. And gradually we can then start to uncover some beliefs that they have, either about themselves or the world that they live in, or thoughts, ideas and beliefs about their future. And we can probably uncover some irrational thought patterns, some beliefs that are irrational in the sense that they don't accord with reason and they're profoundly unhelpful. And for people to continue thinking in the way that they do disturbs them, upsets them, and adds to their suffering. So we, through the order that I've described, we over time, and it's not usually actually it's not that long. This is not long-term Woody Allen-like psychotherapy that goes on for decades. If you're experiencing any therapy or you've ever had any, and after 6 months not much has changed, then just stop and go and do something else. Would be my advice. So we've got something that happens, and which we can call an activating event. And that's filtered through the way that we understand things, and often our irrational beliefs that lead to the consequences for us in terms of the behavior that we engage in and the experiences in terms of our feelings, emotions, and moods. What we can do is, when we've uncovered some of these irrational thought patterns and irrational beliefs, we can dispute them, we can challenge them, we can check them, we can ask ourselves questions about the way we're thinking and why we're thinking the way we are, and end up with more effective emotions, more effective behaviors, and more effective philosophies. So the way that I've described it, you can see that the initial letters in this process are A, B, C, D, E. We look at A, we understand what's going on at B, leading to C, and then we dispute B, and hopefully end up with more effective experiences at E. It's highly practical, and again, it's so in tune with what the Dharma is absolutely replete with. Practical ways of conducting ourselves, practical things that we can do in life. It's one of the things I really love about Buddhism. It's tangible and practice. It gives us guidance. It doesn't just tell us what to do. It explains how to do things. And I think it's complemented my practice enormously.
Interesting. Can you tell us how it's complemented your practice?
I think that when I say, what I meant when I said it's complemented my practice, this is how my understanding of the Dharma and Buddhism has influenced and affected my clinical practice. And at first, in the late 80s, early 90s, when our understanding of things from a clinical perspective were really very different to now.
Mm.
I did experience a degree of nervousness and anxiety in dealing with patients and clients, because I didn't want anybody to think that I was proselytizing, or that I was trying to convert somebody and interest somebody in a spiritual or religious tradition inappropriately. So I was always hesitant to begin with, but I started to introduce mindful-based practices. And this was, you know, quite a long time ago, before it became mainstream in the health service and in health approaches. So we're talking about, you know, round about sort of 1990 time, which seems like a very long time ago, when I was teaching people mindfulness and meditation as part of my clinical practice. And when I was at North Manchester General, when I worked there for a few years, I managed to persuade the powers that be to let me have some money. They let me have £500 at the time to buy some meditation cushions and some blankets. And I used to host these group sessions for staff as well as for patients. So that was the beginning of how it introduced, you know, how I kind of started to incorporate things. And then it started to be talked about. The setup at Bangor University came about, and now we've got other universities like Oxford, the Oxford Mindfulness Centre, and so on. So I'm not trying to say I was a pioneer or anything, but it's for a long time now. I've been introducing ideas into practice, encouraging people to meditate, as well as just secular mindful type practices, and also sort of sneaking in, if you will, discussion about things like the hindrances and the antidotes hindrances. And I've always been careful to say, well, you know, I've got this name because I'm a Buddhist, and this comes from my tradition, and I've always sort of badged it that way. And sometimes people have got interested enough to say, oh, I'd like to follow that up. And I've recommended some texts and some books, and sometimes people have even gone along to, you know, to the centre to hear more about it. So I'm not shy about doing that anymore, because I don't think there's a downside.
Yes, thank you. And I was just thinking about the relation, how if somebody was using REBT therapy, and how they could kind of juxtaposition meditation together with the therapy. It sounds as though it could go quite well. Because I was wondering, what happens if REBT uncovers trauma? Really difficult trauma, horrible trauma from the past.
Okay. Well, maybe just a word on how I see things in a general sense, in terms of our psychological health and well-being. And I tend to see things as layered. So, you know, just to get a picture of it, if you had a rectangular square on a piece of paper, and then you divided that up, so you've got a number of different layers, you would have at the bottom, at the base layer, you would have maybe psychological illness, and this would include psychotic sorts of problems such as schizophrenia, bipolar disorders, basically psychosis that was when somebody was really unwell. They were experiencing delusions, hallucinations, and so on. The next layer up would be someone that was psychologically unhealthy, or they were experiencing quite a lot of psychological dysfunction, to the extent that their lives were being interfered with because of their psychological states. And then we'd have a band or a layer where someone was psychologically healthy, they were psychologically well, but that they were just sort of bobbling along. They weren't making any particular progress in life. They were just kind of existing, really. And then the layer above that would be where people were actually making positive efforts to develop, self-development, growth, spiritual growth. And then I guess at the top layer, you'd have the, you know, however you like to see it, the once returners, the non-returners, the enlightened folk, and so on. So although they're not so clear cut, we could see that there are boundaries between these different layers. And if in the course of any kind of therapeutic activity, and I feel strongly about what I'm going to say now, I think that if you are going to be offering somebody psychological interventions and treatments, whether it's from a psychotherapeutic standpoint, a CBT standpoint, and there's so many, you know, dialectic behavior therapy, acceptance and commitments therapy, solution focused therapy, yada. What I think the onus is on the individual offering it to be able to deal with and handle whatever it is that might be provoked or might come up. And if you're not, you know, trained, equipped, skilled, experienced in doing that, then you probably should be doing something else. Can I just add that if I'm addressing your question directly now,
sure.
Mark, if somebody experiences trauma, it may be that a trauma has been uncovered that somebody has kind of forgotten about, or it's been in the background, or you've stirred something up. You've opened up the proverbial can of worms. Then you can manage that with the individual using still the techniques from the approach that I'm talking about. They can be really helpful.
What, REBT?
REBT, but the thing about REBT is you can incorporate REBT into other forms of therapy. Cognitive behavior therapy, for example, you can incorporate REBT approaches into that, and also into some of the psychotherapies. It's not an either or. REBT suggests that we're wise to have lots of different tactics, strategies, techniques that we can use to help somebody. And we need to be flexible and take an integrative kind of approach to things. If somebody becomes so disturbed that, for instance, they start to experience really significant ideas about self-harm, you're concerned about their safety, then, or about somebody else's safety that they may be coming into contact with, then of course you have the usual duties of care, and you have to, under extreme circumstances, if you can't get the individual to agree and to give you permission to speak about them with someone else, you may have to breach their confidentiality in the interests of protecting them or protecting anyone else from harm, in which case there are various avenues that as professional therapists we can go down.
But one of the pathways, if you like, to assistance would be to take some to A&E. Is that correct? Because each A&E department has a dedicated mental health unit.
Yeah. One of the things you can do is to, depending on how you assess the risk, you could encourage somebody to, in the first instance, get in contact with their GP. You can offer to get in touch with their GP on their behalf, because it's likely that the GP has known the individual over time and would have quite a broad understanding of their lot, as it were. If it's more urgent than that, then you could accompany somebody to A&E. You could ask them, you could make a judgment as to whether they were going to be able to make their own way there. Likely not, in which case you could accompany them. You can also, as a, working in the system as I do, I can get in touch with parts of the service, like the home-based team. I can get in touch with the crisis intervention service, and I could ask somebody in that service to either speak with or even go and visit the person at home.
Okay.
The most extreme circumstance would be if somebody, I don't know, stormed out of your conversation, literally stormed out and said they were going to go and, burn their house down and kill their children or something. Then you would call the police in extremis.
Yeah.
So.
Okay. Yeah, that's serious stuff, isn't it? Very sobering. Can I go back to? I'm interested in the difference between a therapist and kalyana mitra. So it seems to me as though the difference is the therapist has been trained to maybe step back a bit from the client and have techniques which can help that person. But I'd like to hear what you think the difference is between a therapist and a kalyana mitra.
Okay. I'd like to address that question from a slightly different angle.
Yes.
I trained to become a clinical psychologist because I wanted to help people. That was my primary motive. I just wanted to help people, but because I come from an engineering background, and for 10 years I was an aircraft engineer. So I've got this quasi-scientific, technological, practical kind of outlook. So I wanted something that was of tangible, practical use, that would be based in evidence and would have a good body of effective research findings behind it. So I was already steered away from certain sorts of approaches that are more, shall we say, esoteric, more kind of more airy-fairy.
Yeah.
Just revealing my prejudices here. And it was, so, that was what was prompting me to begin with. But in parallel, when I was reading stuff about Buddhism and getting more and more interested in the Dharma, and realizing that the huge contribution in terms of our progress spiritually being the Sangha, and obviously one of the most precious things, the most precious jewels that we have. And within the Sangha, the idea of friendship, kalyana mitra, special friendship, true friendship. A kalyana mitra relationship is a relationship that, in my opinion, along with the Dharma, pretty well gives you everything that you need in order to make progress in your going for refuge. You don't usually need anything other than good friendship. So there's a link between the therapist who comes in and with a client or a patient, you're strangers, but you start to get to know each other a little bit. And probably in most cases, what happens is that the person that is designated as the receiver, the patient or client, starts to become a bit more attached and even a bit dependent on the relationship with the therapist. And your job as a therapist is to allow that to happen, but then to work with the other person in making yourself redundant, so that the individual receiving the help becomes independent, an autonomous, independent individual, which is what we all want through our going for refuge with the 3 jewels. And there are differences, clearly, but it's, again, this is just a highly personal point of view. I'm often disappointed that people that have got really good friends feel the need to seek out, you know, somebody like me doing my day job. And you just need good friends. You just need somebody to hear you, to understand you, to help you, and to discuss with you things about friendship and things in the Dharma and so on. And if you're fortunate enough to have that, and you know, people that are not Buddhists or haven't come across Buddhism, they haven't got that. They don't have the same kind of friendship with people as people in the Sangha have the potential to have. So, you know, lean on, look to your good friends, your kalyana mitra, and deepen those relationships, and you'll be fine.